Hi. One of the common entities that we often see in our clinical practice is pallor or anemia, whether with or without hepatosplenomegaly, jaundice. There are so many conditions that a case can present to you with pallor or anemia. And in this short discussion, we are going to discuss about the concepts behind the evaluation of a case with pallor based on simple history and clinical examination. At the end of this short presentation, definitely you will have some basics concepts whenever you come across a case of anemia or pallor. Okay, come on, let's go and discuss the concepts behind the evaluation of pallor, right? There are 5 parameters that you need to know. Only 5 parameters you need to know in the clinical evaluation of anemia. I don't want any CBC or automated hemogram or peripheral smear study or hemoglobin electrophoresis, osmotic fragility test, chromosomal breakage analysis. There are so many things. I'm going to just find out the cause behind the anemia based on only these 5 parameters. What are all those 5 parameters? Let's see. History. We all know that history is so mandatory. In the next slide, we are going to discuss about how history taking is going to be helpful in the identification of the etiology behind pallor. Liver and spleen. Whenever you have spleen alone, probably you are dealing with a case of a hemolytic anemias. But whenever you have a combination of liver and spleen, it can be either due to bone marrow infiltration. Presence of liver hepatosplenomegaly indicates that bone marrow is infiltrated. Either it can be due to leukemia or either it can be due to a storage disorder. Or it can be an extramedullary hematopoiesis such as thalassemia. Right. Jaundice. Whenever you have jaundice, until otherwise proved, it is a case of hemolytic anemias. Presence of spleen with jaundice indicates that it is predominantly extravascular hemolysis. When you have jaundice along with red colored urine, probably intravascular hemolysis. Extravascular hemolysis, splenomegaly is hereditary spherocytosis or autoimmune hemolytic anemias. Intracellular hemolysis is usually G6PD deficiency. Then, growth. When growth is not affected, when the child is not stunted, you are dealing with an acute process. When the growth is stunted, you are dealing with a chronic process such as chronic hemolytic anemias. Simple measurement of growth parameters, particularly height, indicates that whether you are dealing with an acute hemolytic anemia or an acute process or chronic process. Next, additional signs. For example, when you find a koilonychia, more in favor of an iron deficiency anemia, knuckle pigmentation, more in favor of a B12 deficiency, radial and thumb anomalies, more in favor of a bone marrow hyperplastic disorders, triphalangeal thumb, diamond Blackfan syndrome. So in these scenarios, looking at certain additional signs in physical examination will be very, very useful. So I am going to see these 5 parameters only. Based on that, I am going to give you certain clinical scenarios so that you could arrive the diagnosis within 5 minutes after seeing that case.